Hi everyone, my name is Dr. MichelleRodrigues, dermatologist in Australia, and I have a subspecialty interest in vitiligo. I'm also on the medical advisory board for the Global Vitiligo Foundation. It's really great to be here with you to talk with you about how you can make the most of your interaction with your physician. So first and foremost, it's really important to try to find someone who has an understanding of vitiligo or subspecialty interest within this area. If you're unsure who that is, please see our website, Global Vitiligo Foundation, for more information on dermatologists near you who subspecialise in vitiligo. Second of all, try to get that appointment as early as you possibly can. And the reason is that research shows that if we do embark on treatment within 12 to maybe 24 months, we have a far better chance of being able to stop the progression of vitiligo and to try to get pigment back. That's not to say that if we waited longer, we wouldn't be able to do that, but giving yourself the best possible chance would mean seeing someone as early as possible. I would also suggest getting together your medical history from either your primary care physician or general practitioner with all of your prior medical issues, conditions, medications and allergies, so that you can hand that over to your physician and have a comprehensive understanding of your past medical history. I would also consider making a list of all the questions that you can think of that you might want to ask about vitiligo. Many patients have read many things about vitiligo on the internet. They've heard things from family or friends. So getting the truth and getting the scientific answer to your questions is probably going to be your best bet. And doing that during your consultation with your dermatologist makes the most sense. So make a list so that you don't forget all those really important questions. I would also say it's important to try to get written instructions at the end of your consultation about exactly how you need to apply your creams, how often, where, do they get washed off? And if, of course, you were given the opportunity to have phototherapy or ultraviolet light treatment, which many patients do, I would ask some questions about how often you need to go, when the review appointment might be, and of course, how that relates to application of creams. I think it's also really important to make sure that, if possible, you organise your review with your dermatologist at the time that you are seeing them in order to optimise your outcomes. If you have a child with vitiligo and you are a parent that's accompanying them, please try to reassure them that in most instances, this consultation will involve looking at the skin and working out what treatments are best without any other intervention. Skin biopsies are hardly ever required for vitiligo, and so children really should rest assured in the vast, vast majority of cases, it will be a pretty easy and stress-free consultation. I think it's also important to make sure that you think about support networks. Some people are very, very happy and content with the support that they have from their family and friends, but others really want to deepen connections with others who are sharing the journey of vitiligo with them. If that's the case, please reach out to your dermatologist to find out about local networks in your area, or visit the Global Vitiligo Foundation website and have a look at the support groups that might be in your area. I certainly hope that these tips are helpful in making the most of your interaction with your dermatologist, and I wish you all the very best with your journey on vitiligo. I'm very, very pleased that we are making great progress, and thanks to the Global Vitiligo Foundation and many others, there is hope, there is truth, and there is change happening within the space of vitiligo.